My name is Medina Thompson. I'm the Senior Information and Content Officer at Bliss. And this project is about family integrated care, which is a model of care for babies born premature or sick, which promotes a culture of partnership and collaboration between parents and healthcare professionals working to care for babies on the neonatal unit. And simply, that just means that family integrated care is parents and healthcare professionals working together to care for babies on the neonatal unit. It would be great if you could introduce yourself and just tell me a bit about you and your baby and your neonatal experience.
My name is Elizabeth, and I'm the mother of Blessing. Before the pregnancy, I had a high blood pressure that was 200 plus, over 200. So I've been nursing that for a while before I got pregnant. Even though I didn't know I was pregnant, but it was later on I found out I was pregnant. So I've been going for checkup. Still, my BP has been going back and forth, getting higher, higher. Been taking medication to, control my BP. So everything has been moving fine, good. I had an appointment earlier. Before the appointment, I've been having a stomach pain. So I had an appointment to go for an antenatal. So I'm getting to the clinic. After the checkup, I told them I'm having a little bit of stomach pain, and they said, "Oh, let me just check what's going on." So while waiting, so they had to check. When they checked, they said, "No, the baby's coming out." So I was so surprised, like, "Oh, my baby's coming out," and I think that was 5 months. I was so scared. I was not myself, but I had to just control myself. They had to calm me down, that everything will be fine. So from there, they said they won't discharge me. They had to rush me down into the room. From there, they said, no, we can't, we don't have things to, keep the baby here. So they had to transfer me to another hospital. So I'm getting there. They said, oh, let us just try our possible best just to keep the baby. We don't want the baby to come out this early. So I've been trying on my possible best. But no, not until the second day, I was complaining about back pain. So they gave me a medication just to control the back pain, not knowing that it's gonna get more worse. The pain moved from the front to the back. So I was unable to control myself. I had to shout out, call the nurse, and the nurse had to contact the doctor to come over. While checking, they said no, the baby is coming out already. So they just have to move me to the room, the delivery room. I was just so scared because I don't know what to do. On getting there, it was just like did I say like a surprise or like a movie to me? Because they just had to transfer me from what's it called? The thing they moved me with to the bed. So on getting there, the doctor just had to tell me, "Oh, if you're feeling so way, just push." So I was still relaxing. The nurse was still putting on glove. The next thing, I just pushed my baby just out. I was so surprised and scared because it was so small. I had to rush and carry her, wrap her up, this and that. So they had to bring her back because they put her inside a small island bag. So I I wasn't even expecting her to cry so loud because I was like, oh, the baby is too small and too early to come out. But the voice I had was like, oh, Jesus Christ. So they had to bring her closer to me to have a look. I was so scared I had to tell them, please, no, don't bring her. Just take her away because I was like, Jesus, what is this? Inside a nylon, small nylon bag. I was just confused. So they had to take her away. So they had to transfer me just to rest, to get myself back to normal. Then from there, after resting, they had to come and meet me and they said they need to take me to where my baby is. On getting there, I was just crying because I've never had that kind of experience before and I've never seen such before. So they was just telling me to touch her. I said I can't because it was so small and tiny inside the incubator. So I said no. I was just trying to control myself and crying. Oh, so from there the journey was just so long. And we had now 5 months gone because I gave birth to her March 8th and they discharged us August 8th. So 5 months, 5 months and 5 months and Nico. But I was just so grateful because I I don't know what to say and I don't know where to start from. Because I saw someone there, a young lady, that baby couldn't make it and I felt so bad. But I was just so grateful. Now my baby is doing perfectly okay. She's fine. She doesn't look like a premature again. She looks like a normal baby. So we are good. Blessing is fine now.
So thank you so much for sharing your story and your experience of Blessing and Blessing's birth. Um, you mentioned that there were lots of things that you think were family integrated care on the unit, but that you didn't know the name of it. That no one necessarily mentioned the name of it. So I guess I'd like to talk about how, for the 5 months that you were on the neonatal unit, you were involved in looking after Blessing. So I'd love to know about things like nappy changes, feeding, ward rounds, and skin to skin. If you could tell me a bit about that. So, would you be able to tell me a bit about the things that you did to look after Blessing when you were on the unit for 5 months?
At first, I was so scared to touch her for a while. The second month, I started touching her. And I was teach how to change a nappy. So I'll be able to do it when the nurses are not there. So about the feeding, they feed them through the nose. There's a
The
NG.
NG tube?
Yeah. So I was I was told how to do that too. Because they want me to learn how to do that too. To have the experience. So how to do that, how to take care of the baby, you know, how to use wipes to clean our body. Yeah, I was taught how to do that.
So, you said that it was in the second month
Yeah,
and that it was very scary for you in the first month.
yes.
What was it about it that was scary that was difficult in the first month?
Yeah, the baby is still very, very little. He's still
Mm.
very, very small. So I was so scared to touch her because her body is just, so tiny. So I was just thinking of so many things. Oh, if I touch her, will it not be this? Will it not be that? So I was so scared to touch her. But I had to find the courage to start touching her little, because you can't really touch them.
Mm,
You can only hold their hands, because they said they don't like them being touched. So you can't really touch them. So I
yeah.
started holding her hands, you know, holding her legs a little bit just to make her feel my presence.
Yeah. What helped you to feel more confident as time went on?
Yeah, I was the doctors were and giving me words of encourage, and I have a social worker
Okay.
that is helping me those times throughout the stay in the hospital. Even up to now, I have a social worker that is helping me.
That's really good that you had that support and that you felt like the doctors and the nurses and staff were encouraging you and helping you to feel more confident.
Yes.
Do you remember the first time that you had skin to skin with Blessing?
Oh, I can't remember the dates, but when I go back through my gallery, I can still remember then. Even though I was so scared, but I was just had to summon some courage to, you know, hold her. I had three nurses around to help. So it's the nose tube won't disconnect from the ventilator. So they had to just help with the baby, putting her on my chest. So it was just a great experience, and I felt so relieved and happy because she should I say, she was so happy for me. Us seeing me holding her, because throughout the skin to skin, she was just trying to look at my uh my eye, my face. She was just raising her head up to look at me. So I felt so emotional. So it was a great one.
Yeah, I can imagine that it was a really special moment
Mm-hmm.
to have that time with her
Yeah.
um, physically together.
Yeah.
Were there things that made it difficult for you? I know that you were here on your own, in the UK on your own, and I know that you had a social worker, but
Yeah.
was it difficult to be alone during that time?
Yeah, it was. Because during that period, my blood pressure was still going up, on and up. Going to the hospital every day, me not sleeping, and from there, they dictate that I had a kidney problem due to the high blood pressure. It was just so stressful for me. I won't lie. A lot was going through my mind, because I was like, how am I going to cope? What would I do? Where would I start from? Being the holy one, you know, just a lot. It was a lot for me.
Yeah. It sounds like a really difficult situation, especially when your health wasn't good
Yeah.
and you were worried about Blessing.
Mm-hmm.
And also, like you said, traveling to the hospital every day.
Yeah.
Did you stay in the hospital or were you staying somewhere else?
My social worker, they got me an accommodation.
Okay. So you were traveling every day to the hospital.
No, not even traveling, because it's not far from the hospital. It's just a walk.
Okay. Well, that's good. That's something that you were close.
Mm-hmm.
And the accommodation, was it, did it make you feel more comforted to be closer to Blessing?
Yeah, yeah. It's gave me a lot of relief. Should I say I feel, or I felt relieved, There's no need for me thinking about, oh, nobody will be there for me, no one will pay for my accommodation, and so it was just, it means a lot to me.
Good. It's really good that you had that. Were there things that you wanted to do with Blessing as she got stronger that you were important to you, that you wanted to do with her?
In what uh aspects, please?
In the sense of, um, clothes you wanted her to wear once she started wearing clothes or those kind of things.
Yeah, I was referred to Happy Baby Community when I was still pregnant then. Ever since I had Blessing, I haven't find time to go there. But my social worker introduced a baby bank, and they've been trying with some clothes. But it can be compared to you having enough to get a clothes for your baby. Like you want to get this for your baby. But the baby banks are really trying because they give her clothes, nappies, and buggy. But I still wish, I can, I am capable enough to get some things for my baby myself.
Yeah.
That I won't have to, yeah, I won't have to get things, the clothes that has been, uh, someone else has wore before. So I would love to get a new things for her.
And I think that's a special thing to be able to pick out what you want for your baby. So
Yeah.
I can imagine that it can be hard to have to rely on what's available and not necessarily what you want.
Mhm. Yeah.
When you were in the hospital towards the end of the 5 months, did you room in with with Blessing at the hospital? Did
Yes. Uh I didn't know that will be, but at some point they had to let me know because they need to monitor me to know how would I be doing when I leave the hospital with the baby. They want to know if, when the baby's crying, if I will be able to attend to the baby, if I will be able to know what she needs, maybe when she needs a nappy changed or when she's hungry. So I had to stay there for a while. I think for like for like 2 to 3 weeks. I think so. I had to stay there. You know, they had to put me through some things. The more weight goes up, the more feed increase. So I need to learn a lot. They had to show me a lot, learn a lot before going home. What to do when there's there's emergency, all those stuff I was being taught before leaving the hospital.
and before you even got to the rooming in section of your time,
Yeah.
when the healthcare professionals were teaching you how to be involved and how to change her nappy and things like that,
Yeah.
what was it about that teaching process that was helpful?
Yeah. Before moving to that place, she moved from uh the former room to the school. So from there she was just on um as I think 0.1 or 0.2 oxygen. So she's no more in the incubator. Then I was taught how to breastfeed her and how to feed her with bottle, how to change her nappy, and how to change her clothes.
And how was that?
It was a good experience because then I spend more time with her then than before. Because before, I she's in the incubator. I can't really touch her. I can't hold her. But when she's out of the incubator, then I cannot hold her more longer than when she's still in the incubator.
What about what things did the staff do that made that a good experience for you? How did they help you?
Is it with the changing of nappies or?
With the changing of nappies and changing of her clothes and feeding, you said that it was a good experience, them teaching you those things and helping you to be able to be Blessing's mother.
Yeah, I had no experience about being a mother. So there are some special things there that are based on breastfeeding, and the nurses helps with the nappy change. So most times when I'm there, they won't do it, but they will stand there and watch me do that to correct me if there's any mistakes and to let me know this is how it's been done, and pull me through so many things. And the feeding, the position to position her when feeding, they had to correct me to be able to make her feel comfortable when I'm feeding her. So all those things really, really help so much. And with when I'm pumping, they help with the pumping thing too. So they really, really help with all those process then.
That's really good that they were supportive
Yeah.
and that it helped you to feel confident to to be yeah, to be Blessing's mother. What other things helped you? What things made the situation better?
What things like
Like, was there anything that the staff did that helped you, or anything that Happy Baby community did that helped you to
yeah, about that. Happy Baby helped me by giving me a doula.
okay,
So the doula was there for me throughout the pregnancy and when I had my baby. So she always come around, comforts me, makes me feel much more better. When I feel down, when she notices I'm not okay, she try all her possible best to make me feel happy and give me some words of encouragement. Pray for me and tell me to believe everything will be fine and I should keep praying.
so it was that support that you had from someone else that really helped you through your journey?
Yeah, yeah, my doula from Happy Baby community. She was like, let me say, uh she was like a mother because our words meant a lot to me. She had to share some experience just to make me feel much more better, to comfort me anytime, maybe when I'm crying or when I'm down. She just keep telling me I should not give up. I should believe in myself and I should always pray to God and be thankful. So she's a good person and she did a lot.
I'm really happy that you had that support um, from someone who, like you said, provided the kind of feelings of having a mother with you,
Yeah.
which is really powerful to get through what was a really traumatic and really difficult time. For other parents who listen to this and are in a similar situation, either they have a premature or a sick baby and they're in hospital, or they're alone here and don't necessarily have the support of a doula or of a community. Do you have any advice?
Um, Let me say yes. How can I put my words? Yeah, I would just advise them to just keep praying. They should believe in themselves. No matter what the situation, God is watching. So they should just, and don't keep things to themselves because it's really, really hot. You keeping things to yourself, not pouring out your mind, it's weaken more because you it's you feel so sad not having anyone around talking to, and that can even cause high blood pressure because you don't have anyone to talk to. You keep things to yourself. You don't know who is who. You don't trust anyone. You just want to be careful. You just want to you don't want to complicate things. No, you need to just open up because I believe if you open up, people that will help, and they should believe in themselves, never to give up, and to always pray, no matter what the situation. Just even if it's just 10 minutes with God, just stay in the corner of your room and pray to God Almighty, because I know He can see and He can hear, so He knows every situation everyone is going through. Just don't give up and believe in yourself.
And is there any tips that you would have for healthcare professionals, so doctors and nurses who are looking after families, on things that they can continue to do to support families?
Yes, uh, it's not all the nurses, but some nurses are very, very good. Some don't even care. Some treat you like, because I can still remember one nurse, I don't know, she treated me somehow that I had to cry and told my social worker she had to come down to talk to the doctor about it. They just need to encourage mothers. They don't wish to be where they are. They don't pray to have the baby born earlier. So they shouldn't do anything to complicate the situation. Because no mother prays to come or stay in the hospital for long with the baby. No, it's not their happiness. They just need and try to please make the mothers happy in every situation, not to complicate things with them when they're in the hospital.
Yeah, that makes sense. Just to support people and know that people are going through a really tough time and that they're often
Yeah,
struggling and that they need support.
some mothers comes to the hospital smiling, you'll think they're happy. But deep down, when they leave the hospital, you don't know what they pass through, you don't know what they go through. Because me, I come to the hospital, I smile a lot. I don't let anybody know what I go through. But when I get home, I think about the baby, the situation, my blood pressure, my kidney problem. It's really, really do weigh me down. But I don't want anyone to see what I go through. So that's why when I go out, I prefer to smile as if nothing is wrong with me. But deep down, I know there's a lot going on.
I think that's it's really hard to have to put on a an attitude or a face of you're okay
Yeah.
when really lots of things are going on and it takes a lot of energy.
Mm-hmm. Yeah. That's why when the nurses treated me in one kind of way, I had to tell the other nurses, I don't pray to be here. I don't wish to be here. It's not my happiness seeing my baby in the incubator, coming here morning and night to sit down with my baby. No, I don't wish for this. So you don't need to complicate things by making me feel so bad. To the essence of me thinking about my baby and still me thinking about how you're treating me over here. No, no. That is not helping at all. It will worsen the situation.
I'm really sorry that you had that experience with some of the staff,
Yeah.
but I think it's really good that you spoke up for yourself and spoke to your social worker and
Yeah. I
made
was
sure
so
that,
I was so happy my social worker was able to stand up for me to call then come over to meet their the doctor to talk about it. And later on I think they talked to the lady. She was just, I don't know if it was real or if it was fake, but later on she was trying to be a nice person, you know. And I understand. I'm not there for her. I'm there for my baby. So
yeah.
I need to focus on my baby.
Do you think that it was made more, your situation was harder and Blessing's birth was more difficult because you were by yourself here?
How am I going to explain that situation of a thing? Yeah, let me say yes. Because being alone, no one to support you, trying to survive, struggle with life, everything in general, you know, being alone, no one to talk to can cause a lot. It can damage a lot. Cause and you still speak up and people you speak up to still use your word against you, still make you feel bad. It's breaks it breaks people down. So that's why I don't really trust people to open up to people about my situation or anything I'm going through because no matter what, they will pretend as if they care, but deep down they will still make jest of you. So why not keep things to yourself? And why keeping things to myself too is not good because it still affects my health too. So what to do, I don't know. But just, you know, just talk to God and pray to God.
Yeah, I understand that. I really do. It's a balance between, like you said, not necessarily trusting people or thinking that they're going to support you, but also, like you said, keeping things in doesn't help either.
At all. It makes it worse. Because there are some words you feel like you need to pour out. It will be a bond for you to put that on your chest. Yeah, to wake up and think about that. You go to bed, you think about it. You don't have anyone to open up to. Just like a load. And you really need someone to just pour it out to. But still scared to even still say, okay, let me say it out to this person. Hope I'm not going to regret it when I do that.
And I suppose that's why it's so important to have organizations like Happy Baby Community
Yeah,
that have helped you and provided you with a doula who's a safe
yeah,
person for you to trust and talk
yeah,
to, and things like having a social worker that you can trust.
yes, yes. I then it really my doula really really helped because then I do I do talk to her, anything or if I'm not really that okay, she'll just be like, oh, you can call me, you can talk to me anytime. If you need anything, just call me, let me know. Sometimes when she comes around, I just when I see her, I don't think about anything. I would just be like, oh, then I'll start talking as if I have no one to talk to or I've not, I wanna open up and start gisting just to make me feel much more better.
I'm really happy you had that person to
Yeah.
help you through your journey because it was a particularly long neonatal stay. 5 months is such a long time.
Yeah.
And Is there anything else you'd like to share with me or with other families to help them, things that you've learned?
Um, I think that's all. I just, well, anyone in this situation like this, I just want them to believe in themselves and pray to God. They should always pray to God, no matter the situation. They should not lose hope because prayer is the key. If they think prayer doesn't work, that's a lie. No, they should just don't give up. They should pray and believe in themselves. God is watching every movement, everything. So He knows what is good and He knows what is not good. I'm just so grateful for my baby's journey. I know God wants the best for her, and she has a long way to go for Him keeping her alive. If He doesn't want her to be alive, I know He would have no. He would have just say no. But for her to go through that long journey, no, it's not easy because during that process, during that period, a lot happened. From going from one transferring her from one hospital to another, you know, saying she has this, she has that. But I keep praying, no, that is not for my baby. I reject it for her. So here we are now. Even though some doctors then they say, oh, your baby would this, would that, she might not, or she might. I said, no, that is not for my baby. Now, God wants her here. That's why she's here. So, despite everything, going from one hospital to another, here we are now. My baby's so strong and so good, and she's growing so well. So I'm so happy.
It's really beautiful.
Yeah.
Thank you so much, Elizabeth. I'm really grateful for you for taking the time to talk to me and also to give support to other parents who are in a similar situation, because not a lot of people understand what it's like to have a premature or a sick baby, to
Hmm.
be in hospital, to have to, like you said, transfer from different hospitals and to go through all those procedures and all of that time.
Yeah.
So it's really important that other people who understand can talk to each other.
Yeah. Yeah. It was a great experience. It, it was a great one. A great one. I'm just so grateful.